try to like get as we asked for students, and we are able to get the questions more or less in a stable form, and we are able to frame the questions. And when you look into the pattern, okay, usually what happens is that psychiatry topics I usually go the discussion in this various headings. First is the symptoms of psychiatry, because the confusing terms of psychiatry or the important phenomenology of the psychiatry will be asked. Second will be delusional disorders. There will be a lot of questions on delusional disorders. Then we'll have mood disorders, schizophrenia, anxiety disorders. Then we have eat, sleep, sex, and personal disorders, which is a very important chunk. Substance use disorders, psychopharmacology, pediatric psychology, and community psychiatry. Now, totally we were able to get at the maximum of nearly 8 questions. Okay, and if I'm not wrong, we have got 8 questions from psychiatry. And if you see the 8 questions where how it is asked, okay, first and foremost is the questions that was asked is from the phenomenology chapter, which is a very important and expected chapter. It was asked, one of the question was asked based on the phenomenology, and very importantly, it was expected, where I would have told you in the class or in the one shot, wherever I have met you, I would have told you this is very important, and I have discussed it, and I have told that it is expected, and it is also based on a PYQ. Okay, either it will be a direct PYQ or it is a PYT. Okay. There were no questions on delusional disorders. When coming to mood disorders, okay, again it was an expected and it is a discussed question. So it was a specific question on mania, so it was expected and we discussed, okay, if this type of scenario comes, how will you answer? Okay. And there were no questions on schizophrenia this time. Very nice question that was asked. Okay. And you know, this question, it was very common. It was very simple. That what happened is that it is a PYQ. Okay, it was a previous year question. It was not even a question which was not expected, or something which is not which is out of the blue. It is very expected question. I would have told many times in the class that this question will come, and this is a literal PYQ. And psychopharmacology, there was one question which was like a modified question. Okay, it was not a direct PYQ, but it was also discussed in the class. Again, in the pediatric question, there was one question which is a very expected, and it is also from the previous year topic. I would say that community psychiatry, there was one question which was also an important topic, but it was maybe which was like which was not discussed most of the time, because we will be mainly discussing on what to say, Ballari Model or District Mental Health Program or MH Gap. Now this was a different question, but if you use just your common sense, okay, you need not know the spelling of psychiatry. Okay, even if I ask you the spelling of psychiatry, you say it's PCCEC, okay, it's okay. But if you read the question, you know the answer. Okay, that was a very common sense based question. So we'll directly pitch into the questions. First question, based on the confusing terms of psychiatry. Okay, I'll read the question. If anybody is online, please try to tell me the answer. A person has a false belief. Okay, he's having a false belief that he has a lot of property and is rich, and somebody he knows wants to kill him and take it from him. So basically, he's having some extraordinary wealth or something, and people are trying to take it from him. He appears depressed and physically unwell. Okay. Now, what is this delusion? That's what they're asking. Is it delusion of grandiosity and persecution, or delusion of grandiosity and preference, delusion of nihilism, or delusion of grandiosity and nihilism? Very common. Okay, most discussed in the exam. Okay, the answer was, here the person feels that he's having too much money. Okay, so he's grandiose and he feels that people are trying to kill him. So the answer I will go with is A, delusion of grandeur and persecution. If you see, we would have discussed in the class itself, persecution means what? People are plotting against me. Yes. Reference means what? People are talking about me. That is persecution reference. What is nihilism? I am not fit for anything. I don't exist. The whole world does exist. I want to die. So that is nothing but delusion of nihilism. And grandiosity is that thing, but I am a person who's very famous. I am a person who's a very big celebrity. Okay, I know Shah Rukh Khan, I know Ambani. So I have a lot of contacts. That is nothing but grandiosity. So this is mainly a phenomenology question. You need not know what is mood disorder, what is mania, what is depression. Just know the phenomenology. People trying to kill you, persecution. People talking about you, reference. People saying that he is having extraordinary wealth, which is not true. It's again mania. Okay, so I think this is a very simple question it was asked. So I hope you would have all given it. Okay, next, if you go to the mood disorders question, okay, we'll go to the mood disorders question. In the mood disorders question, if you see, the question says like this: A 30-year-old female is very talkative. She's talkative, okay? Hyperactive. Very good. Doesn't sleep well and spends a lot of money for shopping for the past 2 weeks. What is this? Leave alone everything. Okay. A person is talking too much. She's very energetic. She's hyperactive. She's not having sleep well. Okay. But she's energetic. Okay. A person who's not sleeping well, but she's energetic and she's talkative and hyperactive. She's spending a lot of money. Okay. Involvement of more of pleasurable activities. Now, what happens is that, what is this? And she becomes irritable and angry. Sometimes the mood is having irritable and angry. So the diagnosis is mania. Now you should search for the options. OCD is not there. Yes, definitely. Cyclothymia is not there. Now there are two things. Bipolar 1 episode with the manic episode. Bipolar 2 with hypomania. Now what happens is that, as you know that, I think I would have discussed this a lot of times. Okay, I'll again explain it here. Okay, nothing wrong in explaining again. Say, I've told you many times, when a person is having mania, okay, and depression. Okay, mania and depression. Okay, you call it as bipolar 1. When a person is having depression along with hypomania, okay, it's bipolar. Okay, now what is this difference between mania and hypomania? Is that mania is more of a severe form of the elated mood, where the duration criteria should be more than 7 days. Here it is 4 days. Okay, now here we have put it as 2 weeks, and also it's a clear-cut case of mania because major of the criteria is present. So we're going to the answer of bipolar 1 disorder with manic episode. Yes, anybody who is here who has any other difference of opinion, please, we can discuss it here itself. Yes, yes, because in the class also we would have discussed what is mania. Okay, a person who is depressed will have sad mood. Will be having, see, you should always read depression and mania together. Okay, a person with depression will have decreased or sad mood. Okay, and they will have decreased interest in pleasurable activities. Okay, previous pleasurable activities. Previously I used to spend watching movies. Now I don't have interest. Previously I used to spend time with friends. Now I don't have interest. They will have decreased energy level. They will have decreased attention. They will have decreased sleep. Okay, and they will have decreased confidence. Okay, now this is depression. Now the exact opposite of depression is mania, where they will have elated speech. Okay, or irritable mood. They will have increased elated mood. Okay, they will have increased interest in pleasurable activities. Hyposomnia, they will sleep for 3 hours, but they will be very energetic. They'll have decreased attention, pressure of speech, and flight of ideas, which is nothing but mania. As you all know, the difference between mania and hypomania is 7 days and 4 days. Mania might have psychotic symptoms. Here it will not have psychotic symptoms in hypomania, and they might need admission in mania, whereas they will not need admission in hypomania. So there is a difference. So this is what they have expected you to know. So basically with this knowledge, so the symptoms is of mania. So basically you should know that bipolar 1 disorder will present as mania, bipolar 2 will present with hypomania. Is this clear, friends? Anybody who's here, give a thumbs up if you're able to get this. Yes, friends. Yes, Sayan, Achan. Yes, very good. Next, we'll go to the third question. Under neurosis, we had 2 questions. Okay, 2 questions. One was a very nice question. A 28-year-old software engineer. Okay, there is a question on software engineer. This software engineer visits a psychiatric clinic as he's suffering from sleep disturbance. He's not sleeping. He's having low mood, stress in his current job for the past 3 months. He cannot work properly and having difficulty to balance family and work. He has no prior psychiatric history. What is the likely diagnosis? What is the likely diagnosis? Very basic question. I have told you this many times. If there is a love failure and I am worried, it is adjustment disorder. If I am an exam failure, I am worried, I am adjustment disorder. I am losing a job and I am worried, adjustment disorder. New job, worried, adjustment disorder. Death of a family member, adjustment disorder. So any life event, please write it down. Any life event, if I am trying to adjust to it, it's called as adjustment disorder. So I am going to adjustment disorder. This is not generalized anxiety disorder. I am not going for generalized anxiety disorder because there is a word which is present called as free floating anxiety, not related to any life event. Simply for everything they'll be anxious. Here there is a very important stressor that there is a new job, so the role would be different, the expectations will be different. It is not able to move on with the new expectations. Acute stress and PTSD should be coming in a near death experience. Okay, if it is like what a tsunami or a shipwreck, or it is a terrorist attack, something which is a near death experience, then only we call it as acute stress disorder, PTSD. So some friends have given only adjustment disorder. It's nice. So I've told you again, adjustment disorder is something where you will have a life event. Okay, it will be exam or exam failure, what you were all having before the exam. Okay, where you all like, like what is it, you were all energetic and happy. No, you were all worried, oh my god, will I get the question paper will be easy or not, will I be able to answer everything or not, will I be remember everything or not. But once the exam is over and you are going to get more than 150, you'll be happy, right? You're out of it, out of the so-called depression, will be nowhere. Okay, so that is nothing but adjustment disorder. There's nothing but adjustment disorder. Where the treatment of choice. What is the treatment for adjustment disorder? Okay. Adjustment disorder, mainly we'll go for psychotherapy, which is supportive psychotherapy. Okay. Supportive psychotherapy. Okay. Okay. Plus, need for medicines is only a adjuvant. Okay. If the patient has decreased sleep, they are saying that I don't have sleep, then you'll go for a sedative drug. Okay. If the patient is saying, sir, I'm very anxious, I'm worried about things, then you will go for an anti-anxiety drug. If the person comes and says that I'm feeling very low, okay, if there is having low mood, then you will have a mild antidepressant. But the main line will be always counseling, which is supportive psychotherapy. Yes, friends? Yes, give a thumbs up if you're able to get this. Now, this is a nice question. A man came with a bizarre presentation. Okay, it's a bizarre question to the hospital. Okay, now what is the presentation? Some collateral person gave a history of recent earthquake. Okay, so when reading this itself, earthquake means what? It's a life, it's a near-death experience. Okay, few months back. But what are they saying is it's a few months back it had happened. The person is neither remembers personal information nor why he came to the hospital. So he's amnesia. So they have changed from the PTSD like question to some amnesia pattern. He has come to an hospital that is 100 kilometers away from his home. Okay, what is the likely distance? So basically what happens is three things are there. PTSD like presentation is there, amnesia, dissociative like presentation, amnesia is there, fugue is there. But as, see, if they have stopped the question here itself, if they have stopped the question here itself, I would have told it is amnesia. But when there is a deliberate 100 kilometer away from the place of work or home, it is dissociative fugue. Answer is dissociative fugue. Because wow, very good, many of them has given fugue. Because many a times I have told that the basic difference is amnesia is that the old movies you see heroines, they will shout, they will faint. When you wake them up and ask them what has happened, what she'll say? Who am I? What happened? I don't know. So that is amnesia. That is simple. Aimless wandering. I am in Chennai, but I catch hold of a train and I land up in Calicut, or I land up in Bangalore, or I land up in Hyderabad. Okay. So that is nothing but aimless wandering away from work or home after stress. Okay, that is fugue. Identity, you know, what you see in Bulbulaya or Manachitrata or Chandramukhi or Onion is a person changed from one personality to other personality is called as dissociative identity disorder. I think it's everybody is given dissociative fugue. It means that your understanding is very clear. I've mentioned that aimless wandering away from work or home. And the same example I've given. I am in Delhi. If I'm taking a class in Delhi, I am in Delhi, I reach in Bangalore. If I'm taking a class somewhere in South, I'll say that from Calicut to, I've gone to some Chennai. So that is nothing but distance. You travel. That is dissociative fugue. Aimless wandering. Next, coming to this substance use disorders, I'm going to write very, I'm going to put some 10 stars. Okay, please bear with me. Very important question. This is not a PYT. It's a literal PYQ. Okay, some kind-hearted people like me has framed this question. They want my students to pass. Okay, a patient is brought to the emergency department with signs of opioid poisoning. Emergency department, man. Opioid, man. That's all. What else you want? This is called banana question. I have peeled the banana and I'm ready. I want you to just swallow the banana. The answer is what? What is the treatment of choice? You need to save the patient. Why? The patient will be losing his life because of respiratory depression. So the answer is what? Answer is, why nobody is typing? My God, I thought that everybody will answer this question. What is this? What is the answer? The answer is IV naloxone. Okay. This is very kind-hearted examiner. Okay. You should thank him for this question. Yes, yes, because I've told you, whenever there's a question on opioid intoxication, the answer will be, the symptoms will be meiosis and respiratory depression. Opioid withdrawal will be mydriasis, lacrimation, all orifices bleed. Similarly, last year question was, a person comes with meiosis. What is the diagnosis? Opioid intoxication. Now they have just changed it. What is the treatment? IV naloxone. Very good, very good. So this is very, very, very important. Yes. Now, psychopharmacology was a bit indirect question. Okay, we'll see that. A patient is having schizophrenia. Very good. Developed muscular dystopia. It's not dystopia, dystonia. Okay, it's having some extrapyramidal symptom. Okay, and he's treated for the dystonia. Okay, what do you give for dystonia? If you remember, I would have said diphenhydramine and benztropine. Again, why am I saying this? It's again an FMG question. I'm telling you, friends, I always say that FMG is more difficult, or it's a bit of unexpected question paper when compared to NEET. Okay, why am I saying this? Is because first question paper to ask about antipsychotic side effects related to motor symptoms was from FMG, because they have asked, a person is having schizophrenia, is having some contraction of the muscles. What do you call it as? Dystonia. What do you give? Benztropine. It was all asked in FMG. Now what they are asking is, patient now presents with complaints of dry mouth, dizziness and hypotension. So a patient coming with dystonia, that's different. Dystonia, you gave a medicine, that's different. Now the patient is coming with dry mouth. Dry mouth is because of the anticholinergic drug that you have given. Now, what is the drug it should be? See, basically propranolol is not, because propranolol is one which is given for akathisia. Haloperidol is an antipsychotic. They are asking about what is the drug which is given for the antipsychotic. Okay, so it's not haloperidol or risperidone. The answer is benztropine. The answer is benztropine. Yes, yes. Is this clear, friends? Did you get this? Did you get this, friends? Are you able to get this? Any doubts here? I'm again explaining it. Please bear with me. Yes, I'm explaining it. See, what happens is that I've told you this. Okay, if you remember the workbook, okay, we'll say this like this. A person is having dystonia. Okay, it can be in the either in the collar muscles, or it can be either in the hand, or it can be in the eye, ocular crisis or torticollis. The treatment of choice is benztropine. Okay, this was what was the last year question, but this time they have reframed it. Now, what is the side effect of this benztropine? Is nothing but they will have dry mouth. Okay, that is a side effect. Now, even if you don't know the side effect of benztropine as dry mouth, the treatment of dystonia is benztropine. Okay, that is what they are expecting. Now coming to the pediatric psychiatry, again it was a very nice question. Again, I put some 10 stars here. Okay, it's not like out of the blue question. It's a very expected question that was asked. What they've asked is, a 6-year-old child presents with bedwetting, nocturnal neurosis. They're talking about nocturnal neurosis. Which of the following is a treatment of choice? I've always told you this. What is this? Answer is what? Hey, type, man. You should all know. What is it? What is the answer? What is the answer for this? Answer is nothing but the answer is nothing but Bell and Pat technique. But is there Bell and Pat technique in the choice? No. So what is the answer? Behavior is behavioral therapy. Answer is behavioral therapy. Okay, we're not going to go for cognitive behavioral therapy. Cognition, think your thoughts, think your behavior. No, nothing works here. And that too, it's a 6-year-old child. If they have asked you what is the treatment of choice, medication of choice we can go for, or drug of choice we can go for, imiprapine or something, but they have asked you treatment of choice, so we will always go for behavioral therapy. Because as if you are a mother with a 6-year-old child, okay, if I give you some behavioral therapy and if you give medicines, first thing you'll choose is what? Behavioral therapy, because no mother will come and say, give me medicine, sir. No, right? So that's what. So the answer is behavioral therapy. Okay, so I've told you this many times. So what happens is that I've told you 3, 4, 5. Do you remember 3, 4, 5? The child knows its own gender by 3 years. Encoprosis, that is passing stools or feces in the dress, is 4 years. Enuresis is 5 years. Now what happens is that there can be a number of causes. Genetic cause, when a mother is having a mad enuresis in her childhood, the child will have enuresis. Local cause would be UTI. Psychological cause would be sibling rivalry, because that 5 years is the age where a new child also comes in the house, and naturally there will be a competition. And the treatment of choice is, what is this? This is called as Bell and Pat technique, which is nothing but works on classical conditioning, behavioral therapy. Yes. The last one is community psychiatry. Okay, now this was a question which students were telling, sir, I was not sure of this, but it's very important. Nice. A girl came with history of schizophrenia to a PHC. Which of the following is a tele mental health program provided by the government of India to deliver mental health care services via telephone and online application? My God, this is called common sense question. This is called common sense question. Tele, mental health. Telephone, mental health. Tele, mental health. Manas is what? Manas is what? Manam. What is it? Manas is where? Where is that? What is that? It's nothing but mental. Okay, so telemanas. Okay, so basically I'll explain what is telemanas. It was started like 2 years before. What happened was, see, basically we had this MH gap. Okay, if you remember, I told you about MH gap. MH gap is nothing but where the previously we used to have developed countries, developing countries and all that. Now we have middle and low income countries, and we found that middle and low income countries have less of the chance of getting psychiatric care. So what they did was, they thought that, okay, rather than these people going to a doctor or a PHC or a community health center or a GH or a medical college or something, let them sitting in their own house. Take a phone, dial a number, 14416, that's a number. It's a toll-free number, 24/7 you can call. Now, there will be a counselor who's sitting in a nodal center. Now they'll give you counseling. It's okay, sir. Now you have failed an exam. It's okay. It's normal. I'll save your number. I'll call you again. They'll settle it. If they find no, this fellow needs some treatment or intensive therapy or counseling, then these people will be assigned to the local GH or the local hospital or the mental health psychiatrist or the district mental health program psychiatrist. Okay, so that wonderful program which was introduced by the Indian government is Telemanas program. Even if you don't know all this, sir, I'm not a psychiatrist to know this, I'm not a community person to know this, I'm not a SPM person to know this, okay, no problem. If you just read the question two times, tele mental health services via telephone. Answer is tele mental health. Manas is what? Mental health. So it is nothing but telemanas. Yes, friends. So that's one thing which is, it was a question which was not a very expected question, but it is a very simple question. Okay. So I think so totally out of 8 questions, nearly 7 questions were discussed in the class, was given in the workbooks, where most of the questions I put 100 stars and I told you to repeat. So, and one question was very like sudden out of the box question, but it's a easy logical question. So I think that's how it has gone. So I'm very happy. So I hope that all the 7 questions you would have got it right, and this question, by using your common sense, you would have got it right. So 8 out of 8, and the strike rate is really good. So all the best, friends. Thank you for your wonderful time and being patient for nearly 20 minutes, and we'll meet soon. Okay, and I hope that you would have answered all of the subjects in the same way with a positive spread. So I'm waiting for your good results. Thank you, friends. Take care. Good night. Bye.